Good afternoon, everyone, and thank you again for being here, and those of you at home for tuning in or listening to this press briefing. I guess to some degree we've got a little bit of good news, and that is that the case count that we announced today at noon is not as drastic as the one we saw yesterday, but it is still very concerning. Today's case increase is 1,147. As opposed to the one yesterday that actually exceeded 2,700. However, we did reach a grim milestone because we now have more than 10,000 cases statewide, 10,297 to be exact. Sadly, we also had an increase of 60 deaths. The total number of deaths statewide is now 370. What we're seeing today, we think, is going to look more like the daily normal going forward. Although we do know that there are still certain test results that are lagging behind, but the 13% increase in cases today is a much more that increase is much more in line with what we expect to see day to day, not the 42% that we saw yesterday, and that's really what I'm trying to communicate to you. But the rate of spread, the number of cases, will always depend upon the degree to which our people are complying with the stay-at-home order, with all of the social distancing guidelines that we're putting out, and minimizing social contact. We knew and have been telling people for a long time that getting through this crisis would resemble a marathon, not a sprint. So I'm again asking people to be patient, to stay in their homes and take the stay-at-home order seriously. Your neighbor's life depends on it, and quite frankly, so might your own. Another bit of good news is that with 53,645 tests to date, Louisiana is second in the nation per capita. This is important because it does help us to see what's out there and gives us a better idea of how to respond and prepare for the future. There are interesting new tools and dashboards that are popping up that are trying to capture whether folks are actually social distancing or not, like Google, which just came out with its community mobility reports. And what its report shows is that Louisiana and our people started to take this seriously around the time of the end of March, which is when I announced an emergency declaration. You can see this goes back to March the 29th, and you can see the graph there. And so we know then, to the degree to which this activity reduced, that the mitigation measures were working and that the spread of the disease was actually slowed. It would be there would be more cases in Louisiana today had we not done that, and that's very clear. Unfortunately, there's other social distancing dashboard by Unicast out there, which is based on aggregated cell phone data that shows that there are still a lot of Louisianans who are not taking this seriously, not complying. And perhaps it is because, for some reason, I have not impressed upon all of our citizens the consequences, the dire consequences of not staying at home. And you can see there's some bright spots out there because Orleans Parish gets an A, which is incredibly important because that is one of the biggest hot spots in the country. But you see that Jefferson Parish gets a B, so they're doing relatively well, and Bossier also. But you see there's large parts of the state that are not doing well, and I'm encouraging everyone to take stock of this. As we mentioned before, this is a statewide problem with respect to the novel coronavirus and the COVID-19 disease. I think it is now in all but 3 of our parishes by test result, but it is in all of our parishes in actuality. So this is a statewide problem. We need everyone paying more attention to the stay-at-home order and being more compliant. Modeling is something that we've talked a lot about, and it's been talked about at the national level. And I know a couple of nights ago, or maybe 3 nights ago now, that from the White House they did a press briefing where they put up some modeling, several different models as I recall. But it's essential that we use modeling to determine how we can best respond to COVID, but also to illustrate to the people how they should best be responding to this, and that is through those mitigation measures that we've been talking about. It helps us to know what we can expect to need in terms of beds and ventilators, and when we might expect that we're going to exceed our capacity in certain regions to deliver life-saving health care. So today we're going to go through a chart with you to help you better understand how the mitigation measures, the social distancing measures, the stay-at-home order, are impacting our communities by slowing the rate of spread. And we're going to specifically focus on Region 1, which is the New Orleans area, because that is where we have the greatest data to analyze. That means the modeling is more mature. And certainly we are working to develop the same information for all the regions of our state, but this is the one that we have today that we wanted to go through with you. This modeling is a collaborative effort between the Department of Health, LSU, the University of Louisiana at Lafayette, Ochsner Health, and Blue Cross Blue Shield of Louisiana. As I mentioned, the 2 data points that we get every day that are most reliable and tell us with the most precision where we are on these curves is the number of individuals hospitalized with COVID-19 and those individuals who died from the disease. These are the numbers that tell us how much COVID is in our state, and do that to a better degree than the actual number of positive cases, because we know that there are a number of individuals out there who are going to be COVID-19 positive, but they're not going to be symptomatic, and they're not going to go get a test, although they can continue to spread the disease. So we have indications, quite frankly, that are giving us some hope, a glimmer of hope. It's still early. But we do know that the amount of compliance that we're getting is not enough in order to have the best possible outcome. So to those of you out there who are complying, thank you very much. I sincerely appreciate, and the overwhelming majority of the state of Louisiana sincerely appreciates what you're doing. You really are helping. But for those of you who are not taking the crisis seriously, I'm asking you to do a better job. Again, the life that you save could be your own. As I've said before, we're not going to enforce our way out of the crisis. It's going to take everyone doing their part by staying apart from others to help us flatten the curve and slow the spread. The death rate in Louisiana is higher than anywhere else in the country. But we are getting much closer to the norm, because what we're finding out is we actually have much more COVID in our state than we previously thought. And so the death rate isn't from COVID isn't that much out of the ordinary. But we do have a higher death rate, and I suspect at the end of this, we're going to still have a higher death rate than most places, because we have underlying health problems in a larger proportion of our population, including those chronic health conditions that make people especially vulnerable to this disease and make them more prone to succumbing to it, such as kidney disease, heart disease, obesity, hypertension, diabetes, those sorts of things. Now, Dr. Bu, who's been with us every day as Assistant Secretary of the Office of Public Health, he's going to go through the chart and explain in more detail what that chart is telling us here and what it should be telling each of the citizens of our state. Yesterday, in addition to extending the stay-at-home order until April the 30th, I also signed a proclamation to ensure that high school seniors and current post-secondary students are able to meet the requirements to be eligible for TOPS, or to be eligible for the continuation of TOPS, whichever the case may be. Among the things that this order does is extend the qualifying ACT score deadline to September the 30th. Also, on an important note, for small businesses that need relief, and there are many of them out there, as a result of this crisis, if you haven't already, you should immediately apply for SBA loans if you're interested in doing so. Time really is of the essence because there's a finite amount that was appropriated by Congress and signed into law a week ago today. Although it's a large amount, $350 billion, it is finite, and I think as you see more businesses around the country apply for these loans, that amount is going to dwindle down, and so we're encouraging people to go to SBA.gov, and fill out an application for the Paycheck Protection Program. This is a loan designed to provide direct incentives for small businesses to keep their workers on payroll, and the SBA will forgive the loan. And this is really important because it's a loan at first, but it can be forgiven. If employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage interest, or utilities. So to find out more, please go to SBA.gov. I'd also like to remind everyone that yesterday we launched a text alert system that will provide timely COVID-19 updates and other critical guidance directly through the governor's office. To sign up, if you want more of this information, please text LA COVID to 67283. LA COVID to 67283. Already, more than 100,000 people across the state have signed up for alerts. Additional information and resources are available at coronavirus.la.gov. Coronavirus.la.gov. So at this point, I'm going to ask Dr. Bu to come up and explain more about the chart that was up there with the modeling, because I know that some of you have been wanting to hear more information about our modeling.
Thank you, Governor. So as the governor said, almost since the earliest cases in the state, we've been working at the department and with partners both in the academic side and health systems and health insurers to build a model that would really let us understand what we should expect and how to predict what COVID-19 would mean for the state, especially when it comes to our most important healthcare resources that we know would need to be there for those most severely affected by COVID-19, and that's hospital beds and ventilators. And you've been hearing us talk a lot about those. You also, as the governor noted, recently heard from the national leadership in the White House about a model that they released. This model was focused on looking at the number of cases across the nation on a daily basis and using essentially fitting that to a mathematical equation to see how things are changing over time. So in the model that we're sharing here, this is slightly different from that because this is a model that's based on the actual dynamics of the way the infection works. This is really the standard way that we in public health look at an epidemic. It essentially models out a population that's susceptible to infection, and then looks at as that population changes and becomes infected, we see these numbers start to rise. And then eventually it reaches a peak where there's nobody else to be infected easily. And those people are then removed from the model, either because, as most people are with this illness, they recover and they are better, or unfortunately, as 370 Louisianans have, they die and are no longer able to be infected. And that's why you see the model come down, or the lines come down. So essentially what this image depicts are a variety of scenarios for the state, depending on how we react to COVID-19 to stop the spread of the virus. Importantly, because we don't have a vaccine and because we don't have treatments that we know can stop COVID-19, our only weapon that we really have is social distancing and staying at home, not coming into contact with somebody with COVID-19. We know from international, national data, and state data that on average, if an individual has COVID-19, they're at risk of transmitting that to anywhere between 2 and 3 people, other people who can then go on to infect 2 to 3 other people. And so left unchecked, that leads to a really rapid rise in cases. And if we look at this graph, the thin red line there that says baseline depicts that scenario, where anybody who has the virus is really not doing much beyond potentially staying home if they're severely ill, to stop the spread of the virus. And what you can see on this graph is that we're plotting the daily hospitalizations, number of new hospitalizations on the vertical axis, and then we're showing you time starting in March with our first cases and going through till March of the next year. So this is a year-long look. I mean, we look at that baseline. If we had done nothing, what we see is that by about early May, end of April, we would be in a situation, again, in Region 1. So these are the hospitals in St. Bernard, Plaquemines, Orleans, and Jefferson Parish, where they'd be seeing upwards of 3,700 to 3,800 hospitalizations a day. These are not total hospitalized. These are people needing to be hospitalized every day. And the day before that, it was 3,600. So these numbers are staggering. And then obviously at a certain point it would decrease. Unfortunately, we know that the capacity in our region would not be able to accept that. And so that's a situation where we have a lot of people showing up to the hospital, hospitals not having access to the needed therapies like ventilators that they need, and high levels of people unfortunately passing away, higher than we're seeing. So fortunately, though, we've taken measures and through the governor's orders to change how likely it is that any one person with COVID is to infect somebody else. Again, it's incumbent on us to actually act on those orders, to not go out and connect with other people or spread the virus. But that's what's depicted here on the other graph. So I'm going to first take you to the blue line, and that right next to it says effective social distancing. So if you remember, shortly after we had our first week of cases, we put in force social distancing rules. So this means people were encouraged to stay home when they were sick. They were encouraged to wash their hands, cough and sneeze into your elbows, and most importantly, stay 6 feet away from people and not have big gatherings. Initially 250 people or less, and then we moved to 50 and now less than 10. So what that graph depicts is what happens to hospitalizations if we just did that. And what we can see is it not only decreases the peak, but it pushes it further away. So the peak moves now out to mid-May. And now rather than 3,700 or 3,800 a day, what we're seeing is about 1,500 hospitalizations a day in the New Orleans area, the Region 1 area. Again, that is a large number to sustain. Following that, a week later, we had the strict shelter in place. And again, now what we've added on top of what I just described is a situation where all of you are hopefully staying home and not going out unless you're an essential worker, not going out unless you have an essential visit. And that doesn't mean every day. That means as needed, going to get things like groceries, gas, going to the pharmacy. And while you're out, taking these same common sense measures, staying 6 feet apart, not bunching up in lines, gatherings down to less than 10. And importantly, for anybody who's sick or has symptoms, you're not leaving at all. You're asking somebody else to bring things to your house, and you're really staying in place. In that scenario, what we see is even further pushing out the peak and really decreasing the number of new hospital admissions. There we see the peak is being pushed out really to early July. And at the peak point of admissions, we're seeing about 500 a day. Again, that is a large number of admissions for the hospitals to sustain, but much different than seeing 3,800. So that's why we've been pushing so much for this policy, because it's really what's going to allow us to continue to push the day away to no vents, push the day away to no beds, and allow the surge activities that the governor's put in place to be able to absorb that extra admission strain that we're seeing. So if I go back to the chart, the black bold line that says current midpoint is showing you where we currently project that we are. And this is because COVID-19, we know people who have this infection can be infectious for up to 2 weeks. And so we really have to give a 2-week period to see these policies actually have an impact on numbers. And so we're sort of tracking along as people have been doing the work that you saw with the heat map of staying at home, not going out and coming together. And so there we are somewhere between that really scary scenario with the red line and the first scenario that we'd like to achieve, which is this blue line. We have indications that we continue to see movement in that direction, especially in those areas that correlate with that map, the areas that overlap with the map that the governor showed you. Orleans, Jefferson, East Baton Rouge, Bossier, we're seeing those areas are really showing the impacts of actually limiting their contact with others. And our hope is that if we can continue to do that, and more importantly, spread that to the rest of the state so that everybody's taking this seriously and taking measures in their own neighborhoods, we will see that line continue to get closer and closer to the purple line. We will push away the peak. We will decrease the number of daily hospital admissions and make it more likely that we're actually able to have the surge measures that the governor's put in place actually be able to absorb those extra admissions. And we're showing you hospitalizations here, but as the governor said, the things that we're tracking through this model are hospitalizations and deaths. And we want to avert deaths most importantly as well. And so thank you, Governor.
Thank you. So at this time, we will take your questions, and I'm assuming you're going to have a number of questions for Dr. Bu on the modeling. Yes, ma'am.